sticky position because he was the employee of a hospital, and they didn't really want him coaching people. He had, you know, a day job, and they were wanting to do that. But he found a way, 2 nights a week on his nights off, to be a coach, and it really turned out to be a blessing in the long run. So tell your story, Larry.
Well, I met Whitney a little over 7 years ago in Palm Springs. I went to one of those medical conventions as an OBGYN, and I think, Gary, you were there as a drug rep.
I was not.
No, somebody,
Phil Parker.
Phil Parker was there. There was a drug rep there who was across the way. And walking along the booth, and I see this booth, and doctors help your patients improve their health and add some revenue to your practice bottom line. Well, it wasn't my practice. I really didn't care because it was the hospital. But the reality is that my daughters had been harassing me and my wife because I was nearly 300 pounds. 2 blood pressure meds, 2 cholesterol meds, pre-diabetic, sleep apnea, and everything else that goes associated with obesity, including short of breath tying my shoes. So it was a bad place. My reality check came when I told one of my patients, you know, your abnormal uterine bleeding is most likely due to your morbid obesity. We've got to work on your obesity because right now we don't have a precancerous condition, but we're going to. So let's work on your obesity. She poked me in the belly. She says, have you looked in the mirror? So a little reality check, but the reality was that it was more important for my wife and my daughters. They were concerned about me. At that conference, my daughter calls me on the phone and said, did you exercise today? I said, yes. And I did. I walked in the hot Palm Springs sun for about 4 hours, and I was depleted and miserable and throwing up. And she said, you're going to exercise tomorrow? I said, no. I had exercised. I went to the Y 6 days a week, 6 months, and I lost $750, which is the family membership, and 2 pounds. Okay? So I did the exercise thing. It didn't work. I then decided, well, what the heck? I might as well go back to Whitney's booth and learn more about this program. Whitney became my health coach. You had asked the question about what makes this different than other programs. Well, I did this like randomized study. My brother started Nutrisystem. I started Take Shape for Life. 13 weeks later, I'm 65 pounds down, which is the guy that's up there. I've lost more since then, but he dropped 45 pounds. Since then, I've dropped 29 more. He's gained 55 pounds, okay? And it's all because I still have a health coach. How long do you have to use meal replacements? Well, I use a couple a day as healthy snacks because they're easy, they're convenient, and it's a lot easier than me trying to find something when I'm busy. But now, guess what? I'm not really as busy anymore. I retired. I retired from obstetrics and gynecology after delivering babies and doing surgery for 27 years, not by choice. I mean, Whitney tried to get me to come along full-time as a health coach because my patients wanted to do what I was doing, but I couldn't tell them about it in the office. And they was like, what did you do? You know, the 19-year-old, I go in to do her exam after seeing her at age 18. She screams when I walk in the room because she didn't recognize me, okay? So people ask me, what am I doing? I say, look, I'd be happy to send you information about a program. Write your name, your number, and your email down, and I'll make sure that somebody gets back in touch with you within 48 hours. And that's how I grew my business. Literally, it just grew anyway.
Like 4 or 5 years.
Yeah, and so it was super exciting because we started to see people around me change and transform. The coolest part, though, was my wife, who said, it's just another gimmick. You're not going to lose this weight. You're not going to keep your weight off. I'm never going to do this. No way, no how. Okay? When my weight started to get close to hers, she was 198 pounds, okay? 5'6", 198 pounds. Well, now she is still 5'6", well, 5'5" and a half, maybe. But now she's 123 to 125 pounds, okay? And, you know, her claim is, I'll never have a husband whose jeans are smaller than mine. You know? But, so the cool part was I became the example for my wife. She decided to do the program because, well, first of all, she wanted a husband who was bigger than her. But second of all, she wanted to be an example for our daughters as well. My oldest daughter lost 25 pounds on plan. My middle daughter lost 12. My youngest daughter lost 15. Everyone in her family is at a healthy weight now, and that's like really cool. Okay. So my question to you guys as physicians and healthcare professionals, you spent a lot of time and a lot of money getting your education. What if suddenly you couldn't do what you trained your whole life to do. How would you deal with it? As an OBGYN, I was doing surgery and delivering babies. I couldn't do that anymore. I developed double vision, reflex problems, fine motor ataxia due to a variant of Guillain-Barré syndrome. I could not function as an OBGYN physician and surgeon anymore. Had I not had this program, and of course, my second day in my hospitalization, Dr. Anderson himself calls me in my hospital bed. My hospital family, all the administrators, no one bothered to come and check on me, despite the fact I'd worked for them for 14 years and in that hospital for 22. Dr. A called me on the second day and said, Larry, how can I help you? Your wife, Lori. How about your daughters? How are they handling you being in the hospital? So I am so glad that I'm in the Take Shape for Life family. I continually have support. My health coach, Whitney, stays in touch with me to this day. How are you doing personally? Is there anything I can do to help you? Is there anything I can do to support you? You know what you need to do. Let's rock this together. So I could have Nutrisystem for a couple of months. I could have Jenny Craig'd it for a few months. I could have Weight Watchered it. But I decided to take Shape for Life. And I'm thankful that Dr. A, this program, and Whitney came into my life.